This is Dr. Leonard with Central Ohio Spine and Joint, and today what we're going to talk about is the Tmj joint, or the temporomandibular joint. It's a very common joint that we see here in the body, having complaints like headache, neck pain, and even pain into the jaw itself. So I've got Bridget here today. She's actually complaining a little bit of lockjaw, or she's having trouble opening up her jaw all the way on that side due to some tightness and stiffness in the joint. So the first thing we do if we have someone in with a TMJ complaint is we have a couple tests that we run to rule out to make sure that it's not something what we would call intra-articular or up in the joint itself. Sometimes you can have some issues with the disc that's up there. In those cases, we actually refer right out to a TMJ specialist, usually a dentist that's done some additional training in TMJ work. But for the vast majority of cases that come in, they're more musculoskeletal based, which means they're functional, they've got some component of tightness, stiffness, or actually even some instability in some cases. We do see a big association of the Tmj joint and the cervical spine, so when patients come in with complaints like headaches, we're always checking the Tmj joint as well. But what we're going to do today, I'm going to show you just some gentle mobilizations on the joint that we do for when people have some tightness or pain in the jaw. So again, she's got a little bit of reduced range of motion on this right side. When I kind of check her opening, so I'm going to have you open up. When she opens up way more on this left side than on the right side. So she has some, more than likely, muscle restriction causing some reduced range of motion on that side. So what we're going to do is we're just going to go in and do some nice gentle stretching with her. So the first one we're going to do is I'm going to slide my thumb down her lower row of teeth here, essentially grabbing onto the mandible, and we're going to just do some nice, easy, gentle mobilization on the joint. None of the moves that we do here in the office are very forceful. Sometimes in the past we've heard patients actually complain of more pain after getting adjusted on the jaw. Nothing that we do in here is super intense. Very gentle, nice, easy stretching and mobilizations. So we'll do a couple more reps here. Second one we're going to do is we're going to do a nice stretch on the masseter. The masseter is the muscle that controls opening and closing of the jaw. So I'm going to actually have her close down on my thumb here. So she's contracting the masseter. And then I'm going to have you take a big yawn for me. When she yawns, I'm applying just a little bit more traction to get a little bit of a stretch. Go ahead, close down again. And a big yawn one more time, open it all the way up. Good, and a big stretch and relax. Okay, the last thing we're going to do here, and one thing that we like to do with all of these tight muscles, is we're actually going to put a couple needles in, do what's called dry needling. Has a really profound effect on the tissue in order to get that tissue to release and improve the range of motion. So all we're going to do is we're going to find the masseter muscle here. There's going to be just a little poke, little placement in the needle, and that's all it is. We're going to put 2 of them in. Good. So these needles would sit in for maybe 5 to 10 minutes until that tissue kind of releases. And hopefully once we take those needles out, you'll see she'll have a significant change in her range of motion. Typically with something like this, we're usually seeing people, a couple times, maybe anywhere from 2 to 6 visits in order to address the tension within the jaw itself. Next, what we're going to do once these needles come out here, I'm going to have her actually demonstrate 2 at-home exercises that you can do to try to help increase that range of motion and decrease a lot of the tension that we see within the jaw. All right, so what I wanted to go over now are 2 simple at-home techniques that you can do on your own, again, to help increase some of the range of motion in the jaw. The first one's going to be a self-mobilization. So the easiest thing would be to kind of grab the lower jaw here. What she's doing is similar to what you saw when we were laying down. She's applying a little bit of pressure, kind of biting down into her fingers there a little bit. After about 5 seconds, she's going to take a big yawn, kind of stretch that tissue down. Very gentle. This isn't a hard grab and pull, just a nice gentle mobilization. Usually do that one more time, close down, hold for about 5 seconds, release, big yawn, stretch down again. Okay? All right, so that's number 1. The second one we're going to do is what we like to call kind of the rest position of the jaw. This is actually going to help activate some of the muscles that are kind of the deep stabilizers of the jaw and actually help turn off muscles like the masseter, which tend to be overactive. So the rest position, it's going to be hard to see here, but I'll describe it, is when you actually place the tongue on the roof of the mouth, your teeth are actually apart so they're not touching, and your lips are closed. Okay, from this position, what you're gonna do is you're gonna drive your tongue into the roof of your mouth. And when you do that, you should feel the muscles of the lower jaw here kind of activate underneath. You're gonna hold for about 5 seconds and then release. Okay, drive it back up again. And usually we recommend anywhere from about 8 to 10 reps at a time. You can kind of space these throughout the day. One thing that I'll say kind of as a bonus here that we really work on our patients that have TMJ issues is just recognizing how much tension you're carrying within your jaw. It's very common, you're kind of busy at work all day long, working at the computer 8 hours, and you don't realize how much you're actually clenching down on that jaw itself. So what we recommend is just, take like a little tiny sticker, place it on your monitor, place it on your cell phone, and every time you see that sticker, I want you to go back to this rest position, tongue on the roof of the mouth, teeth apart, lips together. And what you'll notice is just throughout the day how much tension you're going to decrease by just a simple reminder. Hopefully over time you'll be able to get rid of that sticker and it'll just be kind of second nature of trying to relax as much as you can. So I hope you guys enjoyed this video. Obviously if you have any questions, feel free to reach out. But as always, please like, comment, and share on this video. And we'll keep giving you guys as much information as possible. Have a great day.